Dr. Burt here, upper cervical chiropractor, and I'm going to talk about the 4 different ways that I assess someone's neck. Number 1, visualization. Now, the first thing that I'll do with all my new patients is to simply just look at the front of their neck. Do they have these horizontal wrinkle lines? Now, horizontal wrinkle lines can indicate inflammation and arthritis in that section of someone's neck. So if they have a wrinkle line in the middle of their neck, well, chances are is that they're going to have more inflammation and arthritis at C5, C6. And then lastly, I want to see, are their eyes, earlobes, and shoulders level? Because typically new patients are going to arrive crooked. They're not going to have good posture. Their eyes are unlevel. Their head is tilted. And then what happens is that their shoulders are going to start to compensate. Number 2, palpation. Something as simple as just feeling their neck with my bare hands. I want to pick up on if there's any muscle knots, tightness, swelling, pain, because all these are signs of how healthy their neck is. And it's unfortunate because so many new patients tell me that their previous doctor never even touched their neck. So imagine that. You go see your doctor for neck pain and they just give you pills and prescriptions without ever touching your neck. That's just insane. 3, functional neck exam. Now, how connected is your neck, brain, and your eyes? And the answer is they're all 3 very connected. At least they should be. And that's why I test them all together. And that's why I love NeckCare's device, because they have the technology that allows me to put numbers to every single movement. So as far as the NeckCare functional exam, what that consists of is 3 different tests. It's going to be cervical range of motion, cervical joint position error, and cervical sensory motor control. Now, I know all these words seem a bit fancy, but don't worry, I'm going to explain. The first test is cervical range of motion. How far can you move to the right, left, up, down, ear to shoulder, both sides? Now, here's the catch. I can see if you cheat. Now, what I mean by cheat is that if I ask you to turn as far as you can to the right, and because you really want to get a good score, and so at that end range, you really try and go further, but in doing so, you actually tilt and flex your head forward, well, that's going to help you out. But at the same time, I need to measure that and see, are you actually moving in that true movement? So, for example, if I'm just testing rotation, turning, that's all I want to see. I don't want to see any other movement like flexion or side bending in that score. And that's the cool thing with NeckCare, is that the device will pick up on any accessory movement that you may include to boost your score. All right, the second test is cervical joint position error test, or cervical proprioception. Now, basically, where does your brain think your neck is in space? Because both your neck and your eyes send signals through the brain. You know, we can see something and we can also feel something. Now, do this with me. All right, we're going to do a little exercise. Close your eyes, and I want you to turn your head all the way to the right. Now, can you feel that you're looking to the right? Yes, because your neck is telling your brain that you're looking to the right. Now come back center. Now open your eyes. Are you looking straight forward? Well, hopefully, because when the neck is injured, it may actually send incorrect signals to your brain. You know, you might turn your head to the right and then come back center to find you're actually not looking straight ahead. You might be looking slightly up or slightly to the left, even though you think you're looking straight ahead. So then you have to adjust your neck position. Now the neck and the eyes are fighting. They're sending 2 separate signals to the brain, and imagine the fatigue that's going on every single second of the day, just that small task of just looking straight. So that's what we're testing for with cervical joint position error. Now, the third test is cervical sensory motor control. It's also known as the butterfly test. Now, I'll keep it simple. As you know, the neck, eyes, and brain are all connected. Now, imagine they're all 3 instruments playing in a band. Now, they're all playing the same song, But if they're not in the right sync, then it'll sound terrible. Now, if the neck, eyes, and brain are not in sync, you'll also feel terrible. So the goal with the butterfly test is to see how synced up your neck, eyes, and brain are. And it's also a great way to test fine motor movement of the neck. How controlled and smooth are the movements? And then lastly, and most importantly, what does your neck look underneath the skin? And so the only way to test this is to take an x-ray or a cone beam CT scan. Now with these scans, it's essential to look at the neck from all three different views: the side, the front, and down through the top. Now there's three things on the side x-ray that we want to point out. One being the neck curve, because normal healthy is what we call a lordosis. And this is probably why you heard that rolling up a towel and lying on it is good for you, because it supports the natural lordotic curve that your neck is supposed to have. Now, if you're injured and you start to lose that curve, well, it's either going to go straight or start to reverse in the opposite direction, which really isn't good. Next, I look at the space between the bones. Now, this is where the neck discs are. Now, these neck discs act as cushions between the bones for really healthy movements. Now, if the head or neck is injured and that injury goes neglected, over time, those discs start to wear down and those spaces will become smaller and smaller. And that's not good, because then your body will send calcium in the form of arthritis to strengthen this area of your neck. But too much calcium can cause bone spurs, which can poke into those nerves, causing pain, tingling, and numbness down the arms, and unfortunately some into the fingers. Which brings us to the last thing that I look for on that side view. What does the shape of the neck bones look like? Are they smooth, square ice cubes, or do they look lopsided and have calcified bone spurs on them? Now, doctors call that osteoarthritis, which is your body's natural way of stabilizing your neck so it stays strong. Then we want to see the back to front view. And the purpose of this view is to really see if your head is tilted, if your atlas is tilted, and to see if your head is translated to the left or the right. Now, there's thousands of different combinations in how the head and neck can misalign, but the way it should look is no head tilt, no atlas tilt, and no head translation. The head should sit perpendicularly balanced over the neck with a level atlas. And the last angle I look at is the top to bottom view. And the purpose of that view is to really see if the atlas is twisted or rotated. Because if it is, then that can compromise blood flow, CSF flow, the vagus nerve, and other important nerves up there. So to recap, we have visualization, palpation, range of motion, proprioception, sensorimotor control, and static X-ray or cone beam CT scans, making sure that you have the proper angle for C1. And then after I have all that information, now I'm more confident in determining whether someone might benefit from upper cervical chiropractic care. And I strongly believe that anyone who has ever suffered a head or neck injury should have this assessment done. Even if you don't have any neck pain, it's no different than that routine checkup at the dentist or routine lab work, blood draw appointment with your standard doctor. So if you've never had this test done, I strongly encourage you to get it done by either me or another upper cervical chiropractor. Your brain will thank you in 20 years. I hope this video helps. Take care.